It is from the south of Guinea that the outbreak of Ebola hemorrhagic fever started in December 2013. West Africa is taken aback, just as the international community. And with the medical vacuum that characterizes the first regions where it developed, the virus spread from Guinea to neighboring countries such as Liberia and Sierra Leone. In all three affected countries, Ebola spreads death by exercising havoc. This is the largest epidemic in the history of the virus found in Central Africa in 1976. Fear seizes West Africa. Countries strengthen health controls at their borders. Guinea, Sierra Leone, and Liberia are virtually isolated and placed under surveillance. On August 8, 2014, at its headquarters in Geneva, the World Health Organization declares Ebola a global public health emergency. But already the International Medical Humanitarian Organization, Médecins Sans Frontières, announced that the epidemic was unprecedented, absolutely not under control, and that the situation was getting worse. A few weeks later, on September 18, 2014, in New York, the Security Council adopted a resolution stating that the unprecedented spread of the epidemic was a threat to peace and global security. This is a first in the UN history. Until then, the resolutions related only to conflicts. In the process, the Secretary General of the United Nations traveled to Geneva at WHO headquarters. The meeting between Ban Ki-moon and Margaret Chan, Director General of the World Health Organization, has finalized the largest mobilization of the UN system. Similarly, many governments around the world decided to get involved in the fight against Ebola. War is declared against the virus. The countries of West Africa, in turn, held on November 7, 2014. Finally, in Accra, Ghana, an extraordinary summit of heads of state dedicated to the response against Ebola. The negative impact of the epidemic on the economies of the countries directly affected, human security, the social and humanitarian situation in the region were evaluated during the proceedings in the Ghanaian capital. Preventive measures were then widely disseminated in the West African states and even beyond, on the continent and in the world. Exceptional measures were also introduced in the three affected countries, such as state of emergency, the containment of the population, and the quarantine of many regions. People generally ended up joining the response by adopting preventive measures and facilitating the organization of rescue operations. The virus has claimed more than 11,300 dead for some 27,500 cases, and 99% of victims are identified in Guinea, Sierra Leone, and Liberia. In August 2015, a year after the international mobilization, with the introduction of better studied health measures, the number of contamination is at its lowest level. The response to the epidemic improves in the opinion of specialists. And in the field of research, remarkable advances are recorded in order to find a vaccine. More than 7,600 volunteers who have been in contact with a patient or their inner circle were vaccinated in Guinea.
J'ai été le premier à recevoir ce vaccin contre la fièvre hémorragique Ebola.
I was the first to receive this vaccine against Ebola. We are on the third day today. I'm feeling really good now. True that on the first and second days I felt some soreness, mainly tiredness. At night some fever. But I took ibuprofen, which helped me overcome it. Since yesterday I feel better. And I almost feel as I was before I took this vaccine.
Despite the reservations and warnings of organizations such as WHO and MSF, the virus has claimed more than 11,300 dead for some 27,500 cases. The latest advances in the fight against Ebola are welcomed almost like the announcement of the end of the epidemic. Ebola is already no longer in the headlines of the press in many countries in the region. And in Dakar, Senegal, at the headquarters of the Regional Office for West and Central Africa of UNFPA, the United Nations Population Fund, it is clear that Ebola is not yet defeated.
People have the feeling that the media do not talk a lot about it, but this does not mean that the outbreak is over. There are still some cases of resistance. Liberia has been declared Ebola-free at one point, but we have all seen that there are still some cases, which means that the gains from the coordinated international response are still very fragile, and it is too early to claim victory.
The Ebola outbreak is still there, and today the point is mostly to strengthen the response to the factors that contributed to the spread of this devastating virus. The emergencies include the organization and strengthening of health systems in Guinea, Sierra Leone and Liberia.
Ebola, en fait, est venu nous révéler la faiblesse des systèmes de santé.
Ebola helped highlight the weakness of our health systems of the 3 countries affected by the outbreak, but also of all the sub-Saharan countries.
Les systèmes de santé sont fragiles et restent à renforcer.
The health systems are fragile and need to be consolidated. And we think that with the support of the international community, the progress that has been made in the 3 countries at least help control the outbreak on the one hand, and on the other, make the diagnosis of the actual weakness of the health systems. Health professionals knew about that weakness, but this was not the case with the political leaders and decision makers. There are also all the lessons learned in the response. Everything indeed compels us to extend them in order to put strategies in place for the reconstruction of countries weakened by the epidemic.
There are at least 3 major lessons we can learn from Ebola. The first one is the importance to invest in health systems. The second lesson is the importance of community response. And the third is the importance of partnership with local institutions to address challenges like Ebola.
A feeling certainly shared by the international community, whose mobilization and interventions have done much to address the epidemic.
I think one of the big lessons we learned was the importance of collaboration and coordination, whether it was within the UN system and with other partners, the government. I think a big lesson learned was the importance of collaborating, the importance of working across various sectors, the importance of different players. Some were involved in the actual service delivery, others were involved in having staff to do the surveillance, others were involved in the laboratories, others were involved in the reporting, in the communication. There was a role for a cross-section of players, and the collaboration was important. I think what helped the situation was when there was the realization that everybody was going in different directions, and the UN came up with the Secretary General appointing the UN coordinator, Dr. Nabarro. That helped, because what happened with that was that with a plan of how the coordination process should continue. Instead, for example, instead of having the big UN coordination missions, a lot of that work has now been transferred to WHO as the coordinating agency. So there's a clear plan in going forward. But the work has not stopped, and all the agencies are still contributing and playing their part.
The international community obviously will follow with interest the commitment and willingness of African leaders to invest in the health sector to develop their health system to better protect their populations.
Aujourd'hui, je pense que tous les dirigeants
Today, I think that all West African leaders are aware that they should invest more in healthcare and healthcare systems. When we talk about health systems, we mean first and foremost health professionals, those who work in the sector. Without human resources, we cannot build a health system. What does the term human resources in a health system imply? It is not just about the specialized doctors, but it is mostly about the middle management workers, such as the nurses, the midwives, or the paramedics. Those are the mainstays of the health system. We think that the three countries, with the lessons learned, can, if they remain cautious and put a serious face about it, stay the course or even go beyond.
peut-être même les dépasser.
Lorsque nous parlons de la reconstruction, je pense qu'il y a un peu la question qui est à l'ordre du jour.
When we talk about reconstruction, the issue at hand currently being recovery, if you will, there are important aspects, namely the economic aspect of the recovery, which cannot be done without the involvement of the youth. This is why we earnestly answered the call from the ministers of youth of the three most affected countries of the Mano River, namely Guinea, Liberia, and Sierra Leone. They asked us on the sidelines of the board meeting to assist them in developing an ambitious program for the mobilization and enhancement of the youth. And we think that this is an outstanding opportunity to speed up the demographic dividend in the Mano River Union countries. And in mid-September, we'll bring together these three countries alongside the Mano River Secretariat to move forward in designing these partnerships for the mobilization of the youth of the Mano River Union to speed up the sub-region recovery plan.
Pour accélérer le plan de relèvement de la sous-région.
The Ebola virus is still there. The response must be maintained and supported. And already we should also work to help the countries that have suffered from it recover, taking into account all humanitarian dimensions of the lessons learned from the management of the epidemic. And these are the new fronts on which the teams of UNFPA Regional Office for West and Central Africa will also be deployed.